Welcome back. This segment is sponsored by Metro Health. Well, skin cancer is the most common form of cancer here in the United States, which is why it is so important to get it checked out. Dr. Lawrence McCahill, a surgical oncologist at Metro Health with years of experience treating skin cancer, is here to talk with us about some ways to diagnose it and treat the disease. And I think at this point in our life, there's really nobody that doesn't have someone touched by some version of it, whether it's like a mole they've had to get removed or to something serious. So are you there? Are you seeing more instances of skin cancer?
Yes, skin cancer is definitely on the rise. There's, basically three types that people see, that we see in medicine. One is basal cell cancer, squamous cell cancer, and those are almost always treated by the dermatologist unless they're really advanced, and then I get involved as a surgeon. And then the most serious type of skin cancer, that's the less common but by far and away the most lethal, is melanoma. And that's probably the one cancer that has increased almost more than tenfold in the last 60 years. And we're not certain why, whether it's because people are living longer or just sort of an age of more sun exposure, but that's the type of skin cancer that can kill people.
My question is, okay, in the age that I am, like we're sort of in this, like somewhere between 30 and 50. When we were growing up, or 29,
29, okay.
Or 14-year-old boy in my head. But when we were growing up, like I grew up on Lake Michigan.
Right.
And at the time, there was really no push for like really,
sun
we were
protection.
the kids that would go out with our moms from like 10 in the morning until 4 o'clock in the afternoon.
With baby oil.
With baby oil. Like,
I've heard it.
And
Yeah.
I've read that like the more damage and things like that that you have done before the age of 18 is worse later on. Is that true? Please say no.
Well, yeah, frequent or severe peeling sunburns are a risk factor for melanoma. So everyone can probably remember getting burned once or twice at the beach.
Yes.
But if burning and peeling was something that happened 10 times a summer, that's a high risk factor for melanoma. Fair-skinned individuals, you're dark-haired, and you have a full head of hair, so that's good.
Yes, I do. Yes.
That's good.
That's a good thing.
And so all of those are risk factors, but sort of very fair individuals, blue eyes, red hair are certainly a higher risk factor for melanoma as well. And then work exposure. If you're a farmer and you've been out in the sun for the majority of your life, construction workers, we see a lot of melanomas on the head, neck, shoulders area in those individuals as well.
So what is it that we should be looking for? Because I think all of us get to an age where suddenly we're like, the ones that have grown up and spent a lot of time studying, you're like, is that bad? Is that bad? Is this bad? Is this bad?
Yeah.
What is it that we should be looking for on our own bodies?
I think, so the easiest thing to remember and I'm really addressing melanoma, larger than a pencil eraser, 6 millimeters. So if you can cover a mole, a dark pigmented lesion with a tip of a pencil eraser, you're usually okay. You have some visuals up there now. But the biggest story I hear most frequently from patients is a change. I've had this mole my whole life, and it changed.
Okay, that's a good thing to look out for.
It
That's
got
a good
more
tip.
irregular. It seemed to get darker. It started to itch or bleed. It got raised. All of those are really big criteria for getting it seen and evaluated and biopsied.
So now I've heard, like I've had several friends that have had things removed, just cut out basically of their skin.
Yep.
Then I've also heard as it goes up to surgery. What are the most common types of treatment that you're seeing? Is it more people that are having these smaller things that they're able to cut out, or?
Typically the dermatologist can handle most of these lesions through just a shave excision. If they get more advanced with melanoma, then typically we get a little bit more involved with a wide excision in the operating room and also an evaluation of the lymph nodes. Similar to breast cancer, once melanoma becomes more advanced, you're definitely trying to sort out which individuals may have disease spread to lymph nodes. But most often the dermatologist can remove them in the office.